right, good morning. Thank you everyone for sticking around to the end of the conference. So we'll get started here. Okay, so nothing to disclose. So the objectives of this presentation are to, number one, review the basic principles of transgender health. This is a lot of teaching and education that doesn't happen very formally. Certainly was never taught in my residency. I had exposure to gender-affirming surgery techniques as a resident, but really a lot of this learning about terminology and how to care for transgender folks has really been on-the-job learning. Second, we'll have an overview of genital gender-affirming surgery, and especially the urologic portions of gender-affirming surgeries. And then, of course, to focus on postoperative nursing care and considerations, all things that you might see, whether in the outpatient setting or the inpatient settings. So in terms of the first question is, how many transgender adults in the United States? And this is actually a more difficult question to answer than you would think. And that's mostly because the big nationwide population-based surveys never really assess for gender identity. So the best estimate that we have at this time is about 0.5% of adults in the US identify as transgender, which is about 1.3 million people. This is felt to be an underestimate because of the limitations of questionnaires. This was actually just as recent as 2022, and there have been some new larger population-based surveys that are currently being administered, so hopefully we can get a better idea of the true prevalence. So this was the first comprehensive questionnaire in 2015, the National Transgender Discrimination Survey on Health, to assess all aspects of transgender folks' lives. So going through this study, these are just some, I thought, some important statistics to look at. So almost half were unable to afford medical care. 19% were refused care due to their transgender status, 28% had been subjected to harassment in medical settings, and 50% had to teach their providers about trans care. So there's a lot of trauma related to folks seeking care, seeking health care, so a lot of people actually avoid coming to doctors and seeking out medical treatment. There's a much higher rate of HIV in the trans population than in the general population, and also a much, much higher rate of attempted suicide at 41% versus the general population. This is the largest survey. It was 28,000 respondents. And again, you're going to see some similar themes here, that about a third had at least one negative experience related to being transgender with a healthcare provider. 23% did not see a doctor when they needed because of fear of being mistreated. And a third did not see a doctor because they couldn't afford it. And this was an interesting paper based out of 2 emergency rooms in New York City. This was Mount Sinai and Columbia. And almost half witnessed medical personnel gossiping, mocking, or telling jokes about trans folks. So what I'll say anecdotally is, in my experience being at 2 different institutions as gender-affirming surgery programs were building, is that I've never really seen it malicious like this. I think a lot of it is that people aren't familiar and it's a little bit novel. And so one of the first gender-affirming surgeries we did, there were people kind of outside the hallway congregating like, oh my gosh, she's so pretty, you would never know. And people thought they were saying affirming things, but it kind of makes your patients feel like they're an exhibit. They're like a zoo exhibit. 63% had past refusal of staff to use the proper pronouns. And a lot of that, I think, is education, so we'll talk about pronouns. And 34% had past experience with visibly uncomfortable providers and/or being asked inappropriate questions. So let's start off with some of the basics. So terminology. So first, sex. Sex is a chromosomal or biological genital anatomy. Gender is one's attitudes, feelings, behaviors, and expectations that a culture associates with either males or females. Most cultures view gender as a binary, male or female. Gender identity is one's inner sense of self as male, female, or non-binary on a gender spectrum. So gender identity, it's important to realize, can be fixed, but it also can be fluid. So people's gender identity can kind of evolve over time. Gender presentation is one's expression of gender. So examples of this might include the name that you go by, some of your behaviors, your mannerisms, your speech patterns, the way you dress, or the way you wear your hair. Gender incongruence is the discrepancy between gender identity and the sex assigned at birth. And gender dysphoria, according to the DSM-5, is the distress or the anxiety, depression, and despair due to the gender incongruity. So there's a little bit of controversy about the medical diagnosis of gender dysphoria within the trans community, and it's basically medicalizing transness, and that people feel that we're saying that this is an abnormal identity, when really it's just part of a spectrum of gender identities. So the flip side of this is that in order for folks to actually obtain a lot of medical services, especially here in the United States, typically requires a medical diagnosis. So that is the flip side, that having the medical diagnosis of gender dysphoria does allow people access to care that they probably wouldn't be able to access otherwise. And being transgender is when it describes an individual whose gender does not align with the sex assigned at birth. So this is an umbrella term to describe the full range of the diversity of gender identities. So that includes non-binary folks, people who don't necessarily identify as male or female. And sexual orientation are the sexual and romantic attractions and the behaviors towards others. And it really is important to realize that this is independent of gender identity. They are two separate topics here. So anecdotally, when we had one of our first patients that we operated on, there was a man, there was a woman at her bedside, and everyone assumed that the man was her husband. And so when people came in around it or spoke with her, they spoke to her and the man, assuming that he was her husband, when really in actuality, it was the woman at bedside was her wife. So again, just as you wouldn't assume the sexual orientation of any of your cisgender folks, same thing goes for our trans patients. And then the term gender affirming surgery are surgeries that better align physical characteristics with gender identity. So pronouns are words that refer to a particular person in the first, second, or third person, and gender is often implied. The most common pronouns, she, her, he, him, and they, them. There are also some other less common pronouns, but those are the three most common that you'll see. So some terms to avoid. So there are a bit outdated terms, things like transsexual, transvestite, even the terminology sex or gender reassignment surgery or sex change surgery have fallen out of favor for gender affirming surgery, where it's more patient-centric, where a lot of these terms we're actually not reassigning sex. This is gender affirming surgery. We want to really center the patient here. And of course, gender identity disorder, this was the prior term, the prior diagnosis in the DSM-4. Again, this was implying that there was something wrong with being trans when there isn't. And it's important to respect the language that a patient uses to describe their own experience, identity, or body parts. I will say in my experience, there is a bit of a generational difference. So when I see our much younger patients coming through, our 20, 30-year-olds, a lot of these, the terminology is still evolving. A lot of them, really use terminology, pronouns, but then when I speak with my older patients who are in their 60s, 70s, a lot of them say, oh, pronouns, I don't even know what those are. So there is a bit of a generational difference, and some of the older folks do call gender affirming surgery gender reassignment surgery. And that's just kind of the terminology that they grew up with. So again, just be respectful, kind of meet your patients where they are. So there's a lot of anxiety that people have about caring for transgender folks. A lot of people don't want to say the wrong thing. They're worried about offending a patient. So then a lot of times people just don't say anything. And so I think becoming comfortable with this terminology and actually practicing it and using the terminology will make you more comfortable for when you are caring for trans and non-binary folks.